Good evening. This is Tim Ashe. It is April the 8th, if I'm not mistaken. Here with my evening update to try to give you the latest in Vermont's response to the COVID-19 crisis. It has been, I think, now about 5 weeks since this whole outbreak really took hold of the public and forced many of the changes, both in terms of the government, business, and schools, and in our lives. And it is amazing how each week seems to encapsulate what would normally take years of change. So I want to thank everyone, as always, for your patience as you work through this. It really is a community response. And whether it's been individuals, businesses, all of whom have had to make sacrifices and suffer through these difficult times, I've actually been really amazed at how nimble people have been, how understanding, how supportive they've been of the public health measures that have been put in place. And obviously, we still have some time to go ahead of us, and a lot more will be asked of us. But I just want to start with a thank you to everyone for making Vermont's response as unified as possible. A couple updates to start with. We had 30 new cases reported today throughout the state. It has now resulted in at least a positive test in every single county in Vermont. We have 14 counties. Essex, which is the least populous, along with Grand Isle County, those are the two lowest number of people living there, both now have at least one test. There are 75 people right now who are hospitalized and have either tested positive or are under investigation of a positive test, which means they're in the hospital, they have the symptoms, but they don't yet have a positive test that has come back. So 75 people hospitalized either with a positive test or under some suspicion, investigation of being positive, just to put things in the broader perspective. Yesterday, I had talked about how the governor sent a letter to President Trump and to the Secretary of Defense requesting authority to call up several hundred more Vermont National Guard service people. While we do not have the response to that one, the governor also had sent a letter to the regional FEMA director. FEMA is broken up into different regions throughout the state, and that was to seek federal support under a disaster declaration. So Vermont basically had to affirm that the problems we're facing in terms of meeting this public health crisis and its impact on our state are beyond our state's ability to manage it alone, that we need the federal government's help. Most other states ultimately will be submitting a similar request to the federal government. That one we did get approval. President Trump signed that authorization yesterday. What that means is that for a variety of expenses that the state is incurring right now to fight this crisis, the federal government will provide 75 cents of every dollar at least that's needed to be spent. And we expect that as we're trying to be flexible and quickly put up either medical facilities or get more equipment in the state, various medical equipment, all that stuff, that a lot of money is being shelled out right now. And this is good news because it means the federal government will come in and help support the costs. The things that are eligible for this disaster recovery funding from the federal government through FEMA, it's not an exhaustive list of things that we're going to spend more money on, but it captures many of the things that Vermont is going above and beyond right now to do. The Emergency Operations Center, this is the group that is coordinating all of the statewide resources, people, and volunteers. Emergency medical care, so any of the care that's going above what had normally been planned for as a result of this particular pandemic. Medical sheltering, which is when someone has to be in another setting to be isolated or quarantined. Obviously, if we're putting people up in motels and things like that to get them away from more clustered housing situations, that's an added expense. Medical supplies, the provision of food, water, ice, and medicines that are directly related to the pandemic, security and law enforcement for any temporary facilities. So if we open up, say, a medical facility at Patrick Gymnasium, so we've built it now, if we have to actually start staffing it fully because we have patients there and it requires security, that's the kind of thing. And then also some of the broader communications that have been required of the state. Every time there's a new directive, like yesterday, the recommendation that everyone should be wearing a facial mask if they're out in public. Those are the kinds of things. It's all money that we did not have planned to be spent, and that the federal government will now provide 75%. And I'll just tell you a good, to the extent there are good stories that we can tell during this time. I spoke with the governor and the Speaker of the House a little bit earlier this afternoon, and the governor was talking about the 400-bed medical surge facility that the National Guard has constructed at the Champlain Valley Expo in Essex. And it really is a remarkable turnaround. In a very short period, they created a 400-bed facility, which includes in each of the pods its own sink, hot and cold water running throughout the whole place. And if you've ever been to the fairground, you know that it's basically a big cavernous place. I've played indoor soccer there. There's all sorts of events are held there. And so our National Guard has basically constructed something out of nothing very quickly. And we think also at the cost of only a few $100,000. So the governor was saying he was on a call with around the country, National Guard people are getting called up to help in these ways. And other states were talking about their experience trying to construct facilities similar to what we've done at the Expo. And we're describing costs that were through the roof with facilities which were much less helpful should we need them for medical needs. So it was kind of a positive that our own National Guard has stepped up, moved quickly, efficiently, and provided the kind of resources that our medical professionals will need. It doesn't speak so highly of many of the other states and how ready they are, but we hope many of them have apparently asked Vermont for their advice and drawings to try to replicate what we've done. So that's a little bit of Vermont exceptionalism, which is often overplayed, but in this case, I think it's spot on. Want to briefly tell you that there's an issue that's been coming up that I want to spend a few seconds about. And it speaks to, people are calling it hero pay or hazard pay. And I'll briefly describe, as I see it, what the problem is that needs a solution. So right now, we know that many people are required to be in a physical workplace to carry out what have been deemed essential functions. Those essential functions could be in a healthcare setting, it could be in a retail setting for groceries, pharmacy, and a variety of other things which have been listed as essential functions. Some of those positions require people to put themselves at much greater risk than the general public right now. If you're remote working, you're at relatively low risk. If you have to deal with customers all day, you might be at a very high risk. And so that's compounded by an economic equity issue. So the federal government, in the interest of quickly pumping resources out to the many people out of work, decided that the simplest way to get the most money to the most people was to send out a $600 boost, either to people who are on unemployment or people who are on the soon-to-go-live federal program for sole proprietors and independent contractors. And there's a logic to that. Doesn't require a lot of complex calculations. You take what the person's going to get and you add 600 to it. But as I've mentioned in previous updates, the law of unintended consequences is that there are some people, in fact, many people, who, while they're working, are actually making less money than they would if they stayed home, say, with a kid who's out of school right now, because they would then be eligible for unemployment and they would get the $600 boost, which could quickly exceed the amount of money the person makes just by being at work. So we've got the risk factor with people who are having to show up at work, put themselves at more risk. Then we've got the economic equity issue where the person might actually make less money for going to work, then choosing one of the options to stay home and be even safer than they are by going into work. So there's the problem statement. Now the question is what to do about it. And the very first thing I want to express is that for all the people who are in that description, that category I've just described, I want you to know that we are on it and we are trying to find a way to make sure to support you more financially for the risk that you're experiencing and to try to do right by the economic inequity issue that's been raised by the federal money. And so that doesn't mean there's a simple solution, but it means we're on it and we're going to do whatever we can and we're going to try and make it retroactive so that for the life of this emergency, you will have benefited even if the checks weren't coming in real time. State government has started to be responsive in this way. There are two things that I'll describe that state government has done to try to help rectify this risk factor. Now, the first is the Scott administration worked with the Vermont State Employees Association, which is the union representing state employees. And what they have worked out is a sort of a boost in pay for people who are in particular positions that put them at greater risk. And I'll put them in two categories. The first is a 20% premium pay for each hour worked for people who are in a facility where there has been a positive test for COVID-19 or requires an individual to work directly with someone who has tested positive for COVID-19. So that's a 20% premium for each hour worked for people who are in a facility, state-owned facility where someone's tested positive or working directly with an individual who has tested positive. The second category of people that the state has worked out a sort of boost or hazard pay concept with are all the people who work in what we call 24/7 facilities. So a 24/7 facility in Vermont, it's not the DMV, which is obviously limited hours. It includes things like our correctional facilities, the state's primary mental health hospital, the facility that has come to replace Woodside during this crisis, which is where younger people are confined, and then any agency of human services or state police positions who have to have face-to-face encounters with the public. And the administration has worked out $1.50 an hour premium for those individuals. On top of that, the state has alerted all of what are called the private non-medical institutions. So these might be group homes for kids, group homes for adults, where people are actually sheltered and housed there. And retroactive to March 1st, the state is going to be paying on a higher daily rate so that more money will go to the workforce for the extra risks that they've been taking. So that's what the government has done for many of its own employees. We know that in the private sector, some supermarket chains have stepped up and offered at City Market in Burlington, $3 an hour. Other supermarket chains, some of them $1.50, $2, $1, and other retailers have been coming up with different systems, and other employers have been doing it. Some nonprofits in the mental health field have been paying time and a half for people who are in positions where they have to be face-to-face with clients. So all of these are good things, but it reflects how we've had to come up with a patchwork of strategies to address this federal issue. So what might happen next? First off, we're paying very close attention to the federal government and what they're calling their fourth relief bill. In the coming days, we've seen Speaker Pelosi working with members of the Trump administration trying to come up with a fourth package of federal relief, because even at $2 trillion, the third one didn't quite provide the resources or the resources quickly enough to really get people, businesses, families, everyone the resources they need. So that could include some kind of bonus pay for people who are in essential services who aren't getting the $600 boost checks. I have heard everything ranging from, I believe it was Senator Chuck Schumer, the Senate Minority Leader, saying something like $25,000 for people who are in certain professions and who've been working through this crisis. to some members of Congress who would rather just do nothing and let the free market make the decision. So we're going to keep a close eye on that. The federal government in some ways created this inequity, and if they will take steps to fix it, we'll all breathe a sigh of relief. However, we can't operate under the assumption Congress will get it right. That would be probably not the wisest general approach, but also in this case. So I have asked a number of senators to start working with our fiscal team about a week ago to try to come up with some options where Vermont could put its money on the table to help address this issue. Either our own money or money that will be coming to us from the one of the previous federal relief packages. And the options there are range from complicated to simple. And of course, the simpler the option, it means there might be more inequities built into it, but it's easy to administer. The more complicated might be the fairest, but hardest to administer. So we're always trying to balance these things out. And we could do a lump sum payment to people who fit certain job categories. It could be an hourly pay for the number of hours you work. We could distinguish between part-time and full-time. There are a whole bunch of options, but I really just want people who are showing up at work right now at risk and feeling like you're the only ones who don't seem to have received the federal government's attention, that those of us in state government have heard. You haven't complained, but we understand that it's just not right. It's not fair, and we're going to try to do something about it. Couple other updates tonight. There's one thing which I just think is good for expectation setting. And the Department of Health, each day as they update their information, they sort of revise what they expect to be the number of cases ahead of us and how long they think that we're going to be in this particular situation. And what they're saying officially right now is, and this is subject to change, but they're saying at present, they believe the peak number of cases in Vermont will occur between mid to late April and early May, which means every time you see the curve that you should expect that it doesn't start breaking until sometime in late April, early May. All that could change. The flattening of the curve, which we hope we've been achieving in part with the efforts of people throughout the state. The more successful those strategies are, that could push the date up. But if we ease things up too quickly and people go back out and start reinfecting, it could just start us back on that upward trajectory. So I just think it's good to know that we're looking at late April, early May is when they think we'll peak. That doesn't mean it's over. It means that's when we start coming down on the other side. So keep that in mind. Another update, the Department of Labor, I'd been speaking with the governor about this on and off for the last couple of weeks, expressing many of the calls and questions or concerns I've heard from people who have been filing for the unemployment system and getting busy signals and so on. And we want the Department of Labor, who are working very, very hard. We want them to succeed, and so we're all unified in wanting to make sure that we get it right, rather than blame people and pick political fights. But it does seem now that there's a recognition that they need still more resources than what they had already marshaled to field calls. So we expect in the next day or two, the Department of Labor to come forward with a proposal about how they're going to significantly boost their capacity to take calls, try to siphon off the maybe more conventional calls that come in so that the more trained veteran state employees who are used to the hardest cases can focus on solving problems rather than just dealing with a never-ending cascade of phone calls. So those of us in the legislature who are particularly sensitive to this will be staying on top of it in the days ahead and ask people to be patient as we do that. The last piece is also, it's both a challenge and a bit of good news. You may have read stories recently about the nurses at UVM Medical Center calling for the governor to step in with more masks and other equipment. And I reached out to the governor to inquire about what's the deal in terms of getting equipment out to the hospitals. And what we believe is that many of the facilities have been trying to preserve as much of the equipment as they can, especially knowing that in the earliest days of this crisis, there was a panic about having enough even at a basic level to meet the needs of each facility. And so the good news is we believe that our hospitals right now have a sufficient stock of masks. And now the question is about working with the leadership of the facilities to modify their policies to get them into the hands and on the faces of more of the providers. We understand that the policy has been put in place to try to preserve as many so that if we have a surge of cases, we haven't burnt through them all. On the other hand, right now, there are people who are putting themselves at risk interacting with patients, and we need to make sure that they have secure equipment. One of the bright spots today has been the news from Donna Carpenter, one of the co-owners of Burton Snowboards. Burton today announced that they have stepped up and are donating hundreds of thousands of masks to healthcare providers. A good chunk of those are going to Vermont providers. Another chunk are going to Dartmouth-Hitchcock across the border in New Hampshire, where I should add a significant percentage of the patients at Dartmouth-Hitchcock are actually Vermonters. So in a way, they're not a Vermont hospital, but they largely serve many Vermonters. And then they're going to be a third wave that they send to the epicenter of this crisis in New York City. They expect to have another wave of masks that they're going to be sending out, but I want to send my sort of very, very strong thanks to Donna Carpenter, all of her team at Burton, who have been manufacturing masks to get out into the field very quickly. And it's an example of where Vermont businesses at their best show the kind of leadership our federal government seems incapable of. It should not take the individual initiative of one company to solve a healthcare crisis when we have the federal government and all its resources available. But be that as it may, Donna deserves a tremendous amount of thanks, as does her whole team at Burton, and many people will benefit thanks to the quick turnaround. They also, I should add, were doing, I believe they were calling it goggles for docs. They were taking basically ski goggles and outfitting the lens with something that was more appropriate for a hospital setting versus something that might look cool on the slope. So thank you to the folks at Burton. A true heartfelt thanks. So that's going to wrap my update for the day. I'm going to see you tomorrow. Stay tuned. We'll try to tease out on Facebook and on Twitter what the topics for tomorrow will be. With each day, you never quite know what are going to be the most important things to communicate, but I'm going to do my best, as always, to put them in plain English for you. There's just so much information pounding away at us right now, it can be dizzying. So hopefully you continue to find these helpful. Continue to send me your questions so I can take action when I see the information you're presenting. The people who are doing their best at the top agency level in Vermont state government are doing everything they can, and I give them all praise for the 100% commitment they have. But you on the ground know what's actually going on in a way that none of us who are sort of stage managing from a bit of a distance, we can't see it the same way you can. So please keep sending your information to me, and I'll do everything I can to see that action follows. So good night, and continue to stay safe.